I'm Karen Hoffman. I'm a radiation oncologist at MD Anderson Cancer Center, and I'm going to talk today about NRG-GU013, or the HI-5 trial. So GU013 is evaluating the use of 5-fraction SBRT for high-risk prostate cancer. SBRT, or stereotactic body radiation therapy, is well established and well studied in intermediate risk prostate cancer, but there's limited data for high risk prostate cancer, though there's interest in using it for these patients. So NRG-GU013 is enrolling patients with high risk prostate cancer who will be receiving androgen deprivation therapy and external beam radiation. The patients are randomized between 5-fraction SBRT or multi-week conventional or moderately hypofractionated radiation. At randomization, they're stratified based on whether or not the pelvic lymph nodes are treated, whether or not there's plans for an intraprostatic microboost, the length of androgen deprivation therapy, and whether or not a next-generation anti-androgen will be administered to the patients. The primary outcome for this trial is metastasis-free survival. And we hypothesize that 5-fraction SBRT is non-inferior to multi-week conventional or moderately hypofractionated radiation with regard to metastasis-free survival. Secondary outcomes for this study include physician-reported toxicity and patient-reported outcomes. So we are asked whether or not patients can enroll on both NRG-GU013 and NRG-GU009. And yes, absolutely, patients can enroll in both trials, and institutions can receive double credit for enrolling in both trials. NRG-GU009 is investigating optimal systemic therapy for patients with high-risk prostate cancer, while NRG-GU013 is evaluating radiation treatment approach. The second most common question we get about this study is whether or not patients can receive treatment to the pelvic lymph nodes, because there is increasing use and interest in pelvic nodal treatment for high-risk prostate cancer. And yes, patients can receive pelvic nodal radiation. It just needs to be declared upfront at time of randomization because it is a stratification factor for this study. So this trial is expected to be a practice-defining trial. It will help determine the radiation treatment approach for patients with high-risk prostate cancer. If we establish that 5-fraction SBRT is non-inferior with regards to metastasis-free survival and has acceptable cancer control, it will provide a shorter duration 5-treatment radiation regimen for these patients. This is expected to reduce the burden of treatment for these patients and increase access to radiation therapy for these patients.